Coping with tinnitus is an ongoing struggle for nearly 50 million Americans. It can be described as annoying, frustrating, and sometimes even debilitating. Tinnitus can be a buzzing, ringing, popping, clicking, or hissing noise that really isn't there. The perception of sound when no actual external sound is present. It can be a temporary condition or a chronic one, but currently there is no cure for most types of tinnitus. The hearing specialists at Lake, Ear, Nose, Throat, and Facial Plastic Surgery explain more about tinnitus and how they work with their patients to manage it.
Tinnitus is usually in correlation to nerve damage, so we can't fix the nerve, so we can't make it go away. But there are ways to mask it with hearing aids so it's not as dominant for you. Those are the types of things. But we need to see, is it from nerve damage, or it could be medicine related, that type of thing. So it's an indication to get a hearing test so you can see what's going on. Tinnitus can be described as ringing, roaring, crickets, bees, any types of noises. You'd be surprised how many people describe it different ways. So it can be just any type of noise that you hear in the ears. You can hear it in one ear versus the other, or sometimes it just sounds centrally located like it's just in your head. If you have a sudden impact loss like that, you can have the ringing or the roaring or high-pitched noises, and then as that recovers, it will go away. If it's from, true nerve damage, it's pretty much going to be there all the time. Some people just don't notice it as much as others. Tinnitus can develop over time, and not everybody that has nerve damage has tinnitus. It's just, luck of the draw. Some people have it, some people don't.
The American Tinnitus Association has a few recommendations to help patients find relief. In a 2007 survey of hearing health professionals, respondents reported that roughly 60% of their tinnitus patients experienced at least some relief when wearing hearing aids, and roughly 22% of patients found significant relief. Sound masking devices or modified sound devices like those that create white noise, including things like rain and the sound of crashing waves, have been instrumental in helping patients to cover the sound of their tinnitus. Patients report that learning emotional coping techniques has also helped them to cope with the stress and negative impact of tinnitus. For more information on the hearing aid and audiology services available at Lake, Ear, Nose, Throat, and Facial Plastic Surgery, please click the Ringing Relief story link on our homepage at yourhometownhealth.com.